అందరికీ నమస్కారం అండి. నా పేరు డాక్టర్ ఉమా కటికి. తానా ఎన్ఆర్ఐ స్టూడెంట్స్ కోఆర్డినేటర్ని. ఫిబ్రవరి ఈజ్ అమెరికన్ హార్ట్ మంత్. ఈ రోజు ఏ హై రిస్క్ ఫర్ హార్ట్ అటాక్స్ అండ్ సడన్ కార్డియాక్ అరెస్ట్ అనే చాలా ఇంపార్టెంట్ అండ్ టైమ్లీ టాపిక్ మీద జరుగుతున్న అవేర్నెస్ సెషన్ కి మీ అందరికీ వెల్కమ్ అండి. రీసెంట్ ఇయర్స్ లో మనం చాలా మంది యంగ్, యాక్టివ్, హెల్తీగా కనిపించిన వాళ్ళు సడన్ గా మన మధ్య లేకపోవడం చూసి చాలా బాధపడ్డాము. ఈ ఇన్సిడెంట్స్ ఫ్యామిలీస్ మాత్రమే కాకుండా మన ఎంటైర్ కమ్యూనిటీని కూడా కలిసివేశాయి. ఇది మనకు ఒక స్ట్రాంగ్ రిమైండర్. హెల్త్ హార్ట్ డిసీజ్ ఇప్పుడు ఏజ్ అయ్యాక వస్తుంది అని కాదు. లైఫ్ స్టైల్ చేంజెస్, స్ట్రెస్, ఫుడ్ హ్యాబిట్స్ మరియు అవేర్నెస్ లేకపోవటం వల్ల యూత్ లో కూడా ఈ హార్ట్ డిసీజ్ పెరుగుతోంది. ఈ సెషన్ యొక్క ముఖ్య ఉద్దేశం అవేర్నెస్, ప్రిపేర్డ్నెస్ మరియు హోప్ క్రియేట్ చేయడం. నాలెడ్జ్ ప్రాణాలను కాపాడగలదు. ఎర్లీ వార్నింగ్ సైన్స్ తెలుసుకోవటం, కార్డియాక్ ఎమర్జెన్సీ టైంలో ఎలా రెస్పాండ్ అవ్వాలి అని నేర్చుకోవడం, సిపిఆర్ బేసిక్స్ తెలుసుకోవటం, హార్ట్ హెల్దీ లైఫ్ స్టైల్ ఫాలో అవ్వటం, ఇవన్నీ లైఫ్ మరియు లాస్ మధ్యలో డిఫరెన్స్ క్రియేట్ చేయగలరు. మన కమ్యూనిటీ, మన రెస్పాన్సిబిలిటీ. ఈ రోజు మనతో ఉన్న ఎక్స్పర్ట్స్ మనతో వాళ్ళ వాల్యుబుల్ ఇన్సైట్స్ ని, ప్రాక్టికల్ అడ్వైజ్ ని మరియు ప్రివెంటివ్ టిప్స్ తో మన అందరినీ గైడ్ చేయడానికి వస్తున్నారు. ఈ సందర్భంలో నేను తానా ప్రెసిడెంట్ డాక్టర్ నరేన్ కొడాలి గారిని, తానా ఎగ్జిక్యూటివ్ వైస్ ప్రెసిడెంట్ శ్రీనివాస్ లావు గారిని మరియు తానా ఎంటైర్ తానా లీడర్షిప్, ఎంతో సపోర్ట్ చేసిన ఎంటైర్ తానా లీడర్షిప్ ని మరియు లీడ్ ద ప్యాక్ ఫౌండేషన్ లీడర్షిప్ ని థ్యాంక్స్ చెప్పుకుంటున్నాను. ముందుగా ఈ తానా ప్రెసిడెంట్ డాక్టర్ నరేన్ కొడాలి గారిని కొన్ని మాట్లాడవలసిందిగా ఆహ్వానిస్తున్నాను. సతీష్ వచ్చారండి?
రాలేనట్టుందండి నరేన్ గారు.
నరేన్ గారు జాయిన్ అయినట్లేరండి.
శ్రీనివాస్ లావు గారు కూడా లాగిన్ అవ్వలేకపోతున్నా అని చెప్తున్నారు. సతీష్ గారు
పెట్టారా? ఒక నిమిషం, ఆయన కూడా
లీడర్షిప్ లో పెట్టారు.
మీ సైన్ ఇన్ అడుగుతాందండి కొత్తగాను. సైన్ మీ ఆడియన్స్ చాలా క్వశ్చన్స్ పంపించారండి మాకు. అవన్నీ కూడా మనకి ప్రణతి త్రిపుర తను ఉన్నారు. షీ ఈస్ గోయింగ్ టు మోడరేట్ దట్ Q&A సెషన్. ఇంకా మీరు అప్పుడు పంపించలేదు, ఇప్పుడు పంపించాలి అంటే మా చాట్ బాక్స్ లో మీరు మీ క్వశ్చన్స్ టైప్ చేస్తే డెఫినెట్ గా మన ఎక్స్పర్ట్స్ ఎక్స్ప్లెయిన్ చేస్తారండి వాటి గురించి. మన శ్రీనివాస్ రావు గారు, నరేన్ గారు లాగిన్ అయ్యే లోపు నేను డాక్టర్ వేమూరి గారి గురించి కొంచెం చెప్దాం అనుకుంటున్నానండి. ఇంట్రడక్షన్. డాక్టర్ వేమూరి మూర్తి గారు ఇండో యుఎస్ రిససిటేషన్ ఎక్స్పర్ట్. ప్రస్తుతం ఆయన యూనివర్సిటీ ఆఫ్ ఇలినాయిస్ షికాగో కాలేజ్ ఆఫ్ మెడిసిన్ లో ఎమర్జెన్సీ మెడిసిన్ డిపార్ట్మెంట్ లో అసోసియేట్ ప్రొఫెసర్ గా పనిచేస్తూ కార్డియాక్ అరెస్ట్ పై పరిశోధన చేస్తున్నారు. డాక్టర్ మూర్తి గారు గత 3 దశాబ్దాలుగా అమెరికన్ హార్ట్ అసోసియేషన్ లాంటి ఇంటర్నేషనల్ సంస్థలతో కలిపి ఇండియా మరియు అమెరికాలో సిపిఆర్ ట్రైనింగ్, టీచింగ్ అండ్ రీసెర్చ్ లో సేవలు అందిస్తున్నారు. నేషనల్ ఇండియా హబ్ కమ్యూనిటీ హెల్త్ అండ్ సిపిఆర్ సెంటర్ ని షాంబర్గ్, ఇల్లినాయిలో ఆయన స్థాపించారు. ఆంధ్రప్రదేశ్ లో ఎన్టీఆర్ యూనివర్సిటీ ఆఫ్ హెల్త్ సైన్సెస్, ఎస్వి ఇన్స్టిట్యూట్ ఆఫ్ మెడికల్ సైన్సెస్ తో పాటు ఎయిమ్స్ మరియు ఇండియాలో పలు యూనివర్సిటీస్ కి విజిటింగ్ ప్రొఫెసర్ గా పనిచేశారు. మూర్తి గారు పలు నేషనల్ అండ్ ఇంటర్నేషనల్ అవార్డ్స్ అందుకున్నారు. 2023లో మన తానా ఆయన్ని ఎక్సలెన్స్ ఇన్ మెడిసిన్ అవార్డ్ తో సత్కరించింది. వెల్కమ్ టు ద సెషన్ మూర్తి గారు. ఇప్పుడు డాక్టర్ శ్రీని గంగసాని గారి గురించి గారి పరిచయం. డాక్టర్ శ్రీని గంగసాని గారు ప్రముఖ కార్డియాలజిస్ట్. ఈజ్ వర్కింగ్ విత్ కార్డియోవాస్కులర్ గ్రూప్ అండి. వీరు జార్జియా కాంపోజిట్ మెడికల్ బోర్డుకి మెంబర్ మరియు పాస్ట్ చైర్ గా వర్క్ చేశారు. డాక్టర్ శ్రీని గారు 2024-25లో జార్జియా అసోసియేషన్ ఆఫ్ ఫిజిషియన్స్ ఆఫ్ ఇండియన్ ఆరిజిన్ బోర్డ్ ఆఫ్ ట్రస్టీస్ కి చైర్ గా వ్యవహరించారు. వీరు గాపి వాలంటీర్ క్లినిక్ కి 2010 నుండి ఇప్పుడు వరకు డైరెక్టర్ గా ఉన్నారు. 2019-21లో ఆఫీస్ కన్వెన్షన్ లో చైర్ గాను 2019-20 వరకు గ్లోబల్ హెల్త్ సమ్మిట్ లో చైర్ గాను వ్యవహరించారు. వెల్కమ్ టు ద సెషన్ శ్రీని గారు. థ్యాంక్ యూ అండి. సతీష్ వచ్చారండి. శ్రీనివాస్ రావు గారు
ఇంకా రాలేదండి. ఆయన అకౌంట్ క్రియేట్ చేస్తున్నారండి. జస్ట్ 1 more minute అండి.
సతీష్ గారు ఏంటి సెట్టింగ్ అలా పెట్టారా ఏంటి? కంపల్సరీ లాగిన్ పెట్టమని
మీరు పెట్టినట్టున్నారు సునీల్.
లేదండి, లేదండి. క్రియేట్ లింక్ ఎవరు క్రియేట్ చేశారండి? ఉమా గారు. నేను లెట్ మీ గో అండ్ చేంజ్ లిటిల్ బిట్. ఎవరు క్రియేట్ చేశారు లింక్?
నార్మల్ గా జస్ట్ క్లిక్ చేస్తే రావాలి.
అండి. సమ్
లాగిన్ అయ్యి కొద్దిగా కాంప్లికేట్ చేసింది ఈ రోజు. నాకు కూడా థింక్ ఇట్ వాస్ లిటిల్ బిట్ మోర్ డిఫికల్ట్ టు గెట్ ఇన్.
సారీ అండి. అంటే సెట్టింగ్స్ ఏదో చేంజ్ అయినట్టున్నాయి, అందువల్ల విల్ రీవిజిట్ ద
అందరికీ ట్రబుల్ గా ఉన్నట్టుంది సునీల్ గారు.
యాక్చువల్లీ జూమ్ అకౌంట్ లో లాగిన్ అయ్యి జాయిన్ అవ్వమని వస్తుందండి.
అవునండి.
క్లిక్ అవ్వడం లేదు అన్నమాట. ఇట్స్ నాట్ వర్కింగ్ విత్ క్లిక్.
లావ్రార్ జాయిన్ అయ్యారండి.
ఎవరు జాయిన్ అయ్యారండి?
అకౌంట్ క్రియేట్ చేస్తే
నమస్తే అండి శ్రీనివాస్ రావు గారు.
నమస్తే అండి.
మన ఎగ్జిక్యూటివ్ వైస్ ప్రెసిడెంట్ శ్రీనివాస్ రావు గారు జాయిన్ అయ్యారండి. శ్రీనివాస్ రావు గారు కొన్ని మాటలు ఈ సెషన్ గురించి.
ఒక్క నిమిషం. థ్యాంక్ యూ అండి. ఫస్ట్ ఆఫ్ ఆల్ గంగసాని గారు, on behalf of Tana, our heartfelt condolences for your loss అండి.
Thank you.
And Dr. Vemuri garu and Dr. Srini garu, thank you for conducting this event అండి. Recently we are dealing with a lot of cases with deaths related to heart attacks and cardiac arrest. Almost like every week మనకు ఒక కేసు వస్తూ ఉంది. అపార్ట్ ఫ్రమ్ సెవరల్ అదర్ కేసెస్ అంటే మనకి తానా టీమ్స్ నుంచి మనం డీల్ చేస్తూ ఉంటాం కదా. సో దిస్ ఈజ్ మచ్ నీడెడ్ సెషన్ అండి. అట్లాగే థ్యాంక్ యూ ఉమా గారు అండ్ ద అదర్ తానా టీమ్ ఫర్ కోఆర్డినేటింగ్ దిస్ సెషన్ అండి. థ్యాంక్ యూ అండి.
థ్యాంక్ యూ శ్రీనివాస్ గారు. థ్యాంక్ యూ వెరీ మచ్ అండి. నరేన్ గారు జాయిన్ అవ్వలేదా సతీష్?
ఉన్నానండి.
నమస్తే అండి నరేన్ గారు.
చెప్పండి.
నమస్తే అండి. మా తానా ప్రెసిడెంట్ డాక్టర్ నరేన్ కొడాలి గారిని కొన్ని మాటలు మాట్లాడవలసిందిగా ఇన్వైట్ చేస్తున్నానండి. నరేన్ గారు
చూడండి, లెట్ మీ కీప్ ఇట్ వెరీ బ్రీఫ్. అలాగే మా ఏవిపి గారు కవర్ చేశారు. అండ్ ఐ appreciate all the doctors personally caring about this problem and taking time, and when it is in a time of need, మనకున్న అత్యవసర పరిస్థితి మరి ఇచ్చే అత్యవసర సహాయానికి కూడా ఇది చాలా ఉపయోగపడే కార్యక్రమం ఇది. అందులో అలాగే సేమ్ డాక్టర్ ఘంటసాల గారు, వేమూరు గారు, శ్రీని గారికి అండ్ ఎంతో ఉత్సాహంగా మామూలుగా ఉన్న సమయాల్లో మనకి తానా గుర్తొస్తుంది. కానీ ఇలాంటి కష్ట సమయాల్లో కూడా ఒక రకమైన ఇలాంటి కార్యక్రమాలు కూడా పెంపొందించుకోవడంలో మనము టీం అంతా కూడా కష్టపడి ఇటువంటి కార్యక్రమం ఏర్పాటు చేసినందుకు ఐఎమ్ వెరీ హ్యాపీ అండ్ ఐ హోప్ పీపుల్ విల్ బెనిఫిట్ ఫ్రమ్ దిస్ సెమినార్. థ్యాంక్ యూ.
థ్యాంక్ యూ అండి. థ్యాంక్ యూ సో మచ్ నరేన్ గారు. థ్యాంక్ యూ వెరీ మచ్ అండి. ఎక్స్పర్ట్స్ ద ఫ్లోర్ ఈజ్ యువర్స్ అండి. మూర్తి గారు అండి, శ్రీని గారు.
థ్యాంక్స్ అండి. థ్యాంక్ యూ వెరీ మచ్. యాక్చువల్లీ తానా అధ్యక్షులు నరేన్ కొడాలి గారికి, తర్వాత ఎగ్జిక్యూటివ్ వైస్ ప్రెసిడెంట్ శ్రీనివాస్ రావు గారికి, డాక్టర్ ఉమా కటికి గారికి, entire leadership of Tana and the membership, and those of you who joined from India as well as United States. నాకు ఇది చాలా ఇది చాలా సంతోషకరమైన ఆరోగ్య సదస్సు. సో మేము మన శ్రీని గంగసాని గారు, వీఆర్ వెరీ ఫార్చునేట్ టు హ్యావ్ హిమ్. వీ వర్క్డ్ in API organization together for some of the programs. సో ఇవాళ చాలా క్యాజువల్గా మాడతాం. సో వీఆర్ నాట్ యూజింగ్ ఎనీ సైంటిఫిక్ జార్గాన్. ఓకే, ఇది మామూలుగా ఐ కెన్ ఆల్సో కాల్ ఇట్ యాజ్ ఎ స్మాల్ టౌన్ హాల్ మీటింగ్. ఎందుకంటే తర్వాత మా తెలుగులోను ఇంగ్లీష్లో మాట్లాడితే కొంచెం కమ్యూనికేషన్ మనకి ఛానల్స్ చాలా ఎఫెక్టివ్గా ఉంటాయని నాకు చెప్పారు. సో అదే విధంగా వీ విల్ ట్రై అవర్ బెస్ట్. ఇప్పుడు ఏంటంటే ఇవాళ దిస్ ఈజ్ సచ్ ఎ వ్యాస్ట్ టాపిక్. హార్ట్ డిసీజ్ ఇన్ జనరల్, హార్ట్ డిసీజ్ అమాంగ్ ఇండియన్స్ అండ్ డయాస్పోరా. ఇవాళ ప్రత్యేకంగా మాకు ఇచ్చిన కొన్ని నిమిషాల్లో నేను మన శ్రీని గంగసాని గారు విల్ బ్రీఫ్లీ టాక్ అబౌట్ ద హార్ట్ డిసీజ్, వై చిల్డ్రన్, why students, why young athletes are dying, why women, they're having, they are being misdiagnosed and also not getting proper cardiac care. సో ఈ ఫోకస్ మీద ఎక్కువ మిగతా విషయాలు ఏం మాట్లాడకుండా వీటి మీద చెబుతాం. ముఖ్యంగా ఇండియన్స్ అండ్ ఇండియన్ డయాస్పోరా. సో దీస్ ఆర్ ద వన్స్ వీఆర్ ఫోకసింగ్ అవర్ టాక్ అబౌట్. ఇప్పుడు మీరు చూసే ఉంటారు, ఎక్కడికి వెళ్ళినా కూడా ఇండియాలో.
Sorry, sir. This is Murthy here. My apologies. If you don't mind, can you
Hello.
keep the conversation in English? That will be great. Thank you, sir.
Okay, so you want me to speak in English?
Yes, sir.
Okay,
Thank
no
you.
problem. So, I think, it is very important to understand and also create awareness among Indians and Indian diaspora about the burning problem of heart attacks and sudden cardiac arrest. So these two, heart attacks and sudden cardiac arrest, they're interrelated. So the information that I will be giving along with Srini Garu is out of our own experience. And also we want to make sure that we don't overlap the items, So what is sudden cardiac arrest? Sudden cardiac arrest is an electric problem. So we will call it as the failure of electricity in the house. So whenever there is a sudden stoppage of the heart due to any electrical conduction problem of the heart, we call it as the sudden cardiac arrest. Now, the heart attack is more or less like a plumbing problem. You got plumbing in the house. Now the water goes through the plumbing. If there is a big clot or anything, or obstruction to the plumbing system, and there is no flow beyond that obstruction. So that is a plumbing problem, and that is a heart attack. So both of them are quite interrelated in majority of the cases. So let me talk out of our own experience. Sudden cardiac arrest among Indians and Indian diaspora, they are getting worse and worse. We know that. The information that we are getting from India, from some of the research institutes, gives us more insight into what we can do for Indians and Indian diaspora. As you all know, most of the scientific issues or any kind of medical management we will be doing globally. So that means the research outside India is contributing to the management of Indians as well as Indian diaspora. So actually, this is like a tip of the iceberg. We do not fully understand why Indians and Indian diaspora, they are getting more share of heart attacks and sudden cardiac arrest. We know that according to the recent AIMS study, almost like 50% of the sudden deaths occur in India under the age of 45 years. And I can tell you any number of anecdotes. A 12-year-old kid in India is playing cricket. The cricket ball hits his chest. He stops. The heart is stopped. And he dies. He doesn't have any myocardial infarction. He doesn't have any congenital anomalies. He doesn't have any problem. His problem is the mechanical thrust of a cricket ball hitting the chest. That is called in Latin commotio cordis. So the commotio cordis suddenly stops the heart. Okay, without for anybody playing or anything that happens to you on the chest immediately, it stops the heart. And relatively, it is a benign condition. That means it is, in majority of the cases, it is reversible, provided you have got some bystander. So we are all bystanders. We are not doctors. We are all bystanders when we go outside and try to do something good. So we want to help. So that is a bystander help. If somebody knows how to use the bystander CPR with the hands only, that person can save. On the other side, so let us see, a 70-year-old person with a history of cardiac disease, an Indian or a person belonging to Indian diaspora, he has been ailing with cardiac disease,
ఒక్క నిమిషం మూర్తి గారు,
sudden cardiac arrest.
మూర్తి గారు కనీసం క్షమించండి, నేను మధ్యలో డిస్టర్బ్ చేస్తున్నాను. లేదు, మధ్యలో కొంచెం తెలుగు కూడా మాట్లాడండి. మనకి ఇండియా నుండి కూడా అడిగారండి తెలుగులో మాట్లాడతారా, మాకు అర్థం అవ్వాలి. ఇంగ్లీష్ లో వెళ్ళిపోతున్నారు, కొంచెం తెలుగు ఇంగ్లీష్ కలిపి.
డెఫినెట్లీ. సో ఇప్పుడు ఆకస్మికంగా గుండె ఆగిపోయిందంటే క్రికెట్ గ్రౌండ్ లో అది కమోషియో కార్డిస్. ఓకే, దట్ ఈస్ మెజారిటీ ది కేసెస్లో మనం దానికి బైస్టాండర్ సిపిఆర్ చేస్తే వీ కెన్ టేక్ కేర్ ఆఫ్ దట్. ఇప్పుడు హార్ట్ అటాక్ ఎవరికైనా వచ్చిందనుకోండి, హార్ట్ అటాక్ ఉంటే హార్ట్ అటాక్ అనేది సడన్గా సర్క్యులేషన్ కనుక ఆగిపోతుంది. దేర్ ఆర్ సో మెనీ రీజన్స్. మన సీని గారు చదువుతారు, కంజనిటల్ ప్రాబ్లమ్స్ కావచ్చు, ద ప్రాబ్లమ్స్ విత్ ది కరోనరీ ఆర్టరీస్. మన ఇండియన్స్కి స్మాల్ కరోనరీ ఆర్టరీస్ ఉంటాయి. ఓకే, తర్వాత వీఆర్ ఆల్సో ప్రోన్ టు అదర్ థింగ్స్ లైక్ మాకు ప్రిమెచ్యూర్ మధుమేహం, డయాబెటీస్, బ్లడ్ ప్రెషర్ ప్రాబ్లమ్స్ ఇవన్నీ ఉంటాయి. బికాజ్ వీఆర్ హైలీ ప్రోన్. జెనెటిక్ కంపోజిషన్, ఇప్పుడే మనం ఈ రీసెంట్గా ఫర్ ద పాస్ట్ 10 years ఓన్లీ వీఆర్ ఏబుల్ టు అండర్స్టాండ్ ది జెనెటిక్ కంపోనెంట్ కంట్రిబ్యూటింగ్ టు ది హార్ట్ డిసీజ్ అమంగ్ ఏషియన్స్ అండ్ ఏషియన్ ఇండియన్స్. దాంట్లో చాలా ఉన్నాయి. కొలెస్ట్రాల్ లైక్ ఎల్పిఏ మనకు ఎక్కువగా ఉంటుంది జెనెటిక్. సో వాట్ ఎవర్ ద స్టడీస్ and whatever the management we are doing, ivanni enante we are doing with the research that is done in the Western countries. We really need to do fundamental research. There are so many components we really need to consider. So going back to sudden cardiac arrest. So sudden cardiac arrest, actually let us see, millions of people get sudden cardiac arrest globally. Of course, India lo manaki exact statistics anedi we are exploring. Srinivas Sarmaka garu nenu, we have done one study in Warangal area cardiac arrest registry in WACA. That is the first study we did in a systematic way following the international guidelines. But the information మామూలుగా ఏంటంటే in some countries మనకి ఇన్ఫర్మేషన్ adequate ఇన్ఫర్మేషన్ ఉండదు. అది స్టాటిస్టిక్స్ ఉంటే తప్ప ఆ తర్వాత ఎనీ కంట్రీ look at Chicago, there are underserved communities and there are affluent communities. So the management of sudden cardiac arrest in affluent communities will produce more fruitful results when compared to the backward communities. So managenante we really need to develop some understanding of we need to do some pilot studies both in India or anywhere to understand why in a particular region people are dying. So especially mukhyenga enante the heart disease among women throughout the world, including the United States, is underdiagnosed and undermanaged and undertreated. Why? Because the symptoms, మామూలుగా హార్ట్ అటాక్ ఎవరికైనా వచ్చిందంటే దే డెవలప్ సివియర్ చెస్ట్ పెయిన్, క్లాసిక్గా లెఫ్ట్ సైడ్కి వెళ్ళడం, అవన్నీ ఇవన్నీ మామూలుగా జరుగుతుంటాయి మెజారిటీ ఆఫ్ ద పీపుల్. బట్ ఇన్ ఉమెన్ దెర్ ఈస్ అ లాట్ ఆఫ్ ఇన్ఫర్మేషన్, చాలా ఇన్ఫర్మేషన్ వస్తుంది. దే మే నాట్ హ్యావ్ చెస్ట్ పెయిన్, దే మే నాట్ హ్యావ్ ఆర్ మైల్డ్ చెస్ట్ పెయిన్, మోస్ట్ షార్ట్నెస్ ఆఫ్ బ్రెత్ ఇవన్నీ రావచ్చు. దట్ ఈస్ ద మిస్సింగ్ పాయింట్. Tarvata, most of the women, when you come to some of the countries, cultural values and also the educational, literacy and restrictions of the society, all these things also will contribute to, in general, to an increased, the information that you get from the women is very, very scanty. Okay, now let us talk about the sudden cardiac arrest. Meeku sudden cardiac arrest అనేది అయిందని అంటే హార్ట్ ఆగిపోవడం మీరు హార్ట్ అటాక్ మూలన అయినా కానీ, లేకపోతే క్రికెట్ బాల్ తగిలినా కూడా దేని మూలనైనా, లేకపోతే మెటబాలిక్ డిసీజ్ చాలా ఉన్నాయి, కిడ్నీ పేషెంట్స్లో పొటాషియం ఎక్కువైపోయినా, ఇట్లాంటి వాటికి కూడా కార్డియాక్ అరెస్ట్ జరిగినప్పుడు ఇనీషియల్గా అది హార్ట్ పంప్ ఆగిపోయింది. ఆ పంప్ని మీరు మళ్ళీ రీస్టార్ట్ చేయడం అనేది యూ హ్యావ్ టు డూ ఇట్ ఇమ్మీడియట్లీ. ఐ విల్ టెల్ యూ ద రీజన్. ఇప్పుడు మామూలుగా మనం బ్రీదింగ్, మన నార్మల్గా గాలి పీలుస్తుంటే 21% ఆక్సిజన్ ఉంటుంది అట్మాస్ఫియర్లో. ఓకే, సో మోస్ట్ ఆఫ్ అస్ ఎందుకుంటున్నానంటే దెర్ ఆర్ ఎక్సెప్షన్స్. మోస్ట్ ఆఫ్ అస్ కెన్ సర్వైవ్ అప్ టు 4 to 5 minutes వితౌట్ హ్యావింగ్ ఆక్సిజన్. ఇప్పుడు మామూలుగా గుండె ఆగిపోయినప్పుడు ఆక్సిజన్ ఉండదు. ఓకే, So 4 to 5 minutes, it is very important to understand the concept of hypoxia of the brain. Brain is a very sensitive organ, very sensitive organ. What happens in the majority of the cases, after 4 to 5 minutes, 10% of the brain will start dying every minute. So if you are looking at a person who had a cardiac arrest and has not received any kind of CPR, 50 to 60% of the brain is gone. And brain is the organ that doesn't regenerate. Even though recent information or కొన్ని signals వస్తున్నాయి, కొన్ని neurogenesis అట్లాంటి కొన్ని వస్తున్నాయి, but when somebody loses the brain, 50 to 60% of the brain, it's like a vegetable. So you can say, you know, the person went home, he's alive, but he doesn't have a brain. So దానికి ఏంటంటే, it is very important for us to understand the concept of two things. Number one, సడన్ కార్డియాక్ అరెస్ట్ కనుక వచ్చినప్పుడు ఇమ్మీడియట్గా ఏం చేయాలనేది మీకు అది వస్తాను. దాని ముందర లెట్ మీ టేక్ బ్యాక్. ఇప్పుడు మీకు ఎవరికైనా సడన్ కార్డియాక్ అరెస్ట్ వచ్చిందనుకోండి, యూ రియల్లీ మేక్ షూర్ దట్ పర్సన్ గెట్స్ ఇమీడియట్ బైస్టాండర్. ఇప్పుడు యాక్చువల్లీ అమెరికన్ హార్ట్ అసోసియేషన్ స్పెండ్స్ $150 to $200 million per year in research every year. Okay, every 5 years they produce the so-called guidelines. So these are the guidelines which are written in stone, but they are subject to change because knowledge changes. Every time we look at these research studies, today's research study, where we think, oh, this is the best study, will be trashed tomorrow because we don't have enough evidence 2 years down the line. So we will not be doing the same kind of management that we did 2 years ago. So the guidelines are they are like, you know, they are the ones that we really need to follow in most of the world, you know, like European Cardiological Society ani edana ante. So when you are talking about sudden cardiac arrest, in the year 2008, American Heart Association has done extensive research. Thousands of papers were published because bystander CPR చేయాలంటే 2 components. అంతకు ముందరేమో హార్ట్ చేసినప్పుడేమో కంప్రెషన్స్ చేయాలి 100 to 120 times. రెండోదేమో హైపాక్సియా, టు కౌంటర్ హైపాక్సియా అంటే ఆక్సిజన్ లేకపోవడం వలన యూ టు గివ్ బ్రీదింగ్ బ్రెత్స్ మౌత్ టు మౌత్. కానీ ఆ రోజు డివైజెస్ ఏమి ఉండవు కదా, మనకి మాస్క్లెస్కి వెళ్ళం కదా. సో ఈ 2 కంపోనెంట్స్, వన్ ఈజ్ బ్రీదింగ్, ద సెకండ్ వన్ ఈజ్ కంప్రెషన్స్. దిస్ వాజ్ ద క్లాసిక్ సిపిఆర్ where you provide both breaths as well as the cardiac compressions, period. Okay, now this is the classic CPR. దాని మూలన ప్రాబ్లం ఏమొచ్చిందంటే, ఎవరిలా కనుక పడిపోతే మామూలుగా మౌత్ టు మౌత్ రెస్పిరేషన్ చేయడం తర్వాత అనేది ఇట్ ఈస్ అ కైండ్ ఆఫ్ లాట్ ఆఫ్ పీపుల్ 99% of the people, they are reluctant to do that. Okay, so 2008లో అమెరికన్ హార్ట్ అసోసియేషన్ ఎవిడెన్స్ బేస్డ్ స్టడీస్ బట్టి it said majority of the cases, again majority, exceptions chautan tarvata, majority of the cases you can revive in the first 3 to 5 golden minutes if you do hands only or compressions only CPR 100 to 120 times per minute. It's scientifically it is evidence based information. It's not 90, it's not 130. Okay, so adi ganaka cheste there is a possibility without CPR only 5% of the people may survive. With CPR and automated external defibrillator done within 2 to 3 minutes, you can have 30 to 35% of the people survive. And that is statistically chala significant. Okay, so coming back to the concept, classic CPR anedi, so majority of the cases, people who do not have previous respiratory problems, previous heart problems, so otherwise healthy people in the sense, you know, without these problems, then you can start doing these things. But in infants and children and infants, low common cause of cardiac arrest is not heart related, it is respiratory related. But oxygen supply lekapothe heart agipotundi. It's not that they are having a heart attack, no, but the consequence is the same, they will die. So infants low, children low, తర్వాత drug overdose low, తర్వాత drowning people. So these are the categories that you have to do classic CPR. అంటే బ్రెస్ ఇవ్వాలి, తర్వాత కంప్రెషన్స్ చేయాలి. But in majority of the cases, bystander CPR with hands only, you can have 3 to 4 increase. I would say 2 to 3 statistically significant increase. So with that information provided, so it is always important to raise the awareness. There are so many community programs, thanks to organizations like Tana. Awareness అనేది కావాలి. తర్వాత మనకి lot of inhibitions are there, especially when we are managing the cases in India as well as Indian diaspora. We got so many things going on. So it is important to not only raise awareness, but also to make sure that everybody knows. There are limitations. And also people whom I don't want you to participate, because if you have got any health problems, if you have arthritis of the hands, and please don't do CPR. And also CPR, hands-on CPR needs to be done when the surroundings are very, very safe, okay? And more importantly, everybody has to do, whether it is India or Good Samaritan law, okay? So that will protect you from the liability. In the United States, out of the 50 states, every state has got its own Good Samaritan law. In the state of Illinois, you are completely protected from the civil liability. So to my knowledge, there is not even a single successful lawsuit that is recorded in Illinois where a bystander, a non-physician, or a non-paramedic person has given the hands-only CPR, because it is a humanitarian thing. It is a humanitarian thing, and India has recognized that. They have got also in place the Good Samaritan law. So మీరు ఇండియాలో ఉన్న ఇక్కడ ఉన్న డిఫరెన్స్ ఏం లేదు. యూరోప్లో వెళ్తారు, ఎవరికైనా హార్ట్ అటాక్ ఇస్తుంది, సడన్ కార్డియాక్ అరెస్ట్ అవుతుంది, ఆస్ట్రేలియాలో ఉంటారు. తర్వాత ఓన్లీ డిఫరెన్స్, ద టెక్నిక్ ఈజ్ ద సేమ్. Call 911 in the United States, call 108 in India, or call any number in Australia, their immediate emergency number, and immediately recognize the cardiac arrest, sudden cardiac arrest. Ante kuppagolipovam, శ్వాస లేకపోవడం, circulation లేకపోవడం అనేది you don't check. A patient is not moving. 3 things: patient doesn't move, now he doesn't breathe, and if ఈ conditions can satisfy it, call immediately 911. Bring the patient down to the floor, flat surface లో చేయాలి ఇది CPR చేయాలంటే, and be on the phone for instructions and tell them where you are, where the victim is. And again, in Chicago area, 3 to 5 minutes లో మీకు ambulance వస్తుంది. Unfortunately, in some developing countries, it takes about 45 minutes to 1 hour. Again, I'm not getting into the discussion, but here, living in the United States, it is possible to revive the person provided you take a course and also try to do that. So with that information, and I think there are lots of things we can answer, but I'm going to show you one simple video of the American Heart Association. AED, automated the external defibrillator, is a magic box. You have to use it, because cardiac arrest వచ్చిన తర్వాత you don't know if the heart is completely standing still, then AED doesn't work, or it is having fibrillation, okay, like fluttering of the wings of the bird. అట్లాంటి ప్లేసెస్లో ఏఈడి కనుక లేకపోతే you cannot do a perfect high quality CPR. Is the high quality CPR where you get immediate attention to 911, put the patient on the floor, start compressions, and use AED. And this is our mission. There are countries like Sweden, Denmark, Japan, where the AEDs and also the awareness of CPR is 80%. In the United States, it's only 30 to 40%. I'm not talking about developing countries. It is less than 22% in other countries. So with that, I'm going to show you the video of the American Heart Association for 1.5 minutes. AED is an important component, not just the CPR. I want you to remember that. That's why we are trying our best to get the AEDs in the public places, AEDs in gyms, AEDs in swimming pools, and there are people who are keeping the AEDs. I can give you any anecdotes. When one of the religious institutions, a devotee coming from India, he was survived after 10-15 years ago. So take this one very seriously and try to do your best. Now, AEDs are also available in the market freely, but they are not as popular in the United States when compared to other more advanced, CPR advanced countries like Sweden. So now let us see this AHA video. And I would give the rest, and then of course, Mana Sinigar next to Chataru, then we'll participate in the discussion and all that. So please, Umagaru, please, can you have that video, please? We're not getting any sound.
మ్యూట్ లో ఉందనుకుంటా సతీష్, వినపడట్లేదు.
In the meantime, a question అడగచ్చా?
Yeah.
సో మీరు చెప్పారు కదా, బై ద వే దిస్ ఇస్ సుందర్ వల్లి, తానా మెంబర్ అండ్ వెటనరియన్ బై ప్రొఫెషన్ అండ్ మదర్ ఆఫ్ కార్డియోథొరాసిక్ సర్జన్. సో మీరు చెప్పినందుకు ఇట్లా కామన్ మ్యాన్, ఇస్ దర్ ఎనీథింగ్ దట్ దే కెన్ క్యారీ విత్ దెమ్ టు ప్రొటెక్ట్ దెమ్ సెల్ఫ్? అది ఫస్ట్ క్వశ్చన్. సెకండ్, యాజ్ అ లే పర్సన్, do they have an option to ask for stent or surgery when they come across heart attack? If guidelines prakaram, what do we have?
Yeah. I can answer the first question. The second part will be answered by Dr. Srini. First person is very important. Manamo, we should be prepared. The best way we can save is to use your strong hands. Manavante ippudu COVID-19 vachin tarvata we advocated, masks. Andariki jebulo masks undavamma. Tarvata also handkerchiefs edo pettukuntaru, because the COVID-19 can transmit during chest compressions the virus particles that can infect a person who is doing the bystander CPR. That is a given. It is very important to have the precautions for COVID-19. Now the COVID-19 is slightly, regressed. So not slightly. Now we don't speak about the COVID-19. We are not talking about the ideal situations where somebody like me will carry the entire, paraphernalia. Okay. Or any physician, who is interested in the CPR will do.
మీరు మ్యూట్ లోకి వెళ్ళిపోయారండి. యూఆర్ ఆన్ మ్యూట్ డాక్టర్ గారు.
My sincere apologies. The second question was Srini garu chevataru. The first question ఏంటంటే ఇప్పుడు COVID-19 లో we advocated protect yourself with a protective mask or something. ఏం లేకపోతే మామూలుగా హ్యాండ్ కర్చీఫ్ పెట్టుకోమని చెప్పాం. That COVID-19 era is behind us, hopefully. So మన దగ్గర we are not prepared anything, but the willingness to help the person with the strong hands. But more importantly, you want to make sure that you are trained adequately. Then yesterday we were giving a symposium. The common question that is asked is, am I going to hurt the patient? Now, the hurt anedi, parenthesis. The incidence of you can fracture the ribs 40 to 50% of the time. Even if it is a successful CPR, you can fracture the ribs. Okay, even if you do it perfectly in the center of the chest. But statistically, significantly, nobody died of CPR with the fracture ribs. It's very common. But so that is one thing. Inhibition is something. The second thing is not that if you do a CPR without undergoing training, that may be dangerous, because మీరు పైకి వెళ్ళాలనుకోండి, you may rupture the trachea. కిందకి వెళ్తేనేమో you may rupture the stomach or the liver. And regarding the second question, Srini garu, I think he will be able to answer. Thank you.
ఆడియన్స్ కు చిన్న రిక్వెస్ట్ అండి, డైరెక్ట్ గా క్వశ్చన్స్ అడగొద్దండి. ముందు సెషన్ అయిపోయిన తర్వాత
It is up to you, because
నో మూర్తి గారు, మీ గురించి అనట్లేదు, ఆడియన్స్ చెప్తున్నాను. అన్ని క్వశ్చన్ అండ్ ఆన్సర్ సెషన్ లో అడుగుదాము. సతీష్, మీరు ప్లే చేయండి.
You want to play it in the video, ma'am?
Audio ganaka unte play cheyandi. Otherwise, I will just explain and then we'll give the time to Dr. Gangasani. Without audio, I think, it won't be effective. Okay, no problem.
Is it audio audible?
Dr. Srini Ganga.
Good afternoon, everyone. Thank you, first of all, Tana, Uma Garu, Dr. Naren, and Srinivas Rao Garu for giving me the opportunity. Also, I would like to commend Tana for doing all the wonderful job over so many years. దశాబ్దాలుగా ఇంత మంచి సేవ చేస్తున్నందుకు తానా వారిని రియల్గా అభినందిస్తున్నాను. So, Murthy Garu did a great job with the sudden cardiac death, and I'm just going to go over why Indians have so much more heart disease and then what we can do to prevent it. So, first of all, sudden cardiac death is the most common presentation for a lot of people. So, like Murthy Garu cheppinattu, having a CPR, knowing the CPR could protect somebody, either your loved one or somebody outside as a bystander. So please do make an effort to learn the CPR so that you can help somebody or you can help the loved one. So coming to the South Asians, especially Indians get the heart disease a lot earlier and a lot more aggressive. It happens 5 to 10 years earlier compared to Caucasians. And the heart rate, when it happens, it's very aggressive. When you see a lot more plaque and a lot more presentation as a sudden death. So I think we need to find out. We all know someone who had a heart attack in their 30s and 40s and 50s, like a Tana Gani, Kadamak local Tama Gani. So all the associations, we hear so many fundraisers and GoFundMe because we lost somebody very young because they had a sudden death. So my goal today is to tell you why it happens and what we can do about it. And most of the time, Indian philosophy has been, when we are younger, we have seen more a reactive philosophy. If something happens, I go to the doctor, but not a preventative philosophy. So we need to just move from being reactive to proactive so that we can take care of ourselves. So Murthy Garu cheppinattu, I'm just going to go over a little bit about the sudden death. Sudden death can be because of the sudden cardiac death. Sudden death can be because of other things. Sometimes the brain can have a hemorrhage into the brain. They can die suddenly. Sometimes the aorta or main artery coming out of the heart can rupture, and that can cause a sudden death. Sometimes people can have a blood clots into the lungs, and that can cause a sudden death. So not every sudden death is a cardiac death, but it could be cardiac, but majority of it is sudden cardiac death. When it comes to sudden cardiac death, it could be because of, I think Murthy Garu cheppinattu, it could be because of the heart disease, which is the most common reason. So practically what happens, especially what we see in cardiology world, is plaque, which is the blockage developing over the time. It can happen, start getting your plaque developing in their 20s. We have seen people in autopsies in the young army people, when they died, they had a plaque in their 20s. So plaque starts to happen early. I'll talk about the risk factors, but when there is a plaque, sometimes that plaque ruptures and that makes a blood clot, which makes it 100% within few minutes. So somebody may have a normal artery, which is not causing any problem, like not blocked enough to cause the symptoms, and then suddenly plaque ruptures and forms a blood clot, which makes it 100% within 5 to 10 minutes. So that's how you see people never had any heart problems, suddenly drop dead or have a heart attack, because the plaque, which was non-significant, not more than 70% before that, suddenly ruptures, and that can cause the heart attack. So more than 50% of the plaque which ruptures is less than 50%. So you can do a stress test. You may not have any symptoms, so you're not going to have any problems even if you do a stress test, because stress test only shows if the plaque is over 70%. So a lot of people have this misconception that I had a stress test done, it was normal, so my risk is very low. That's not true. I'm going to go over the little myths about what are the myths what we follow. Just because somebody is really skinny doesn't mean that their risk is low. We see all the time people having a really thin person having heart, especially in Indians. Indians have a more common big belly fat. So that kind of becomes a problem. So you need to look at your belly. If your belly is growing, that means that you potentially could be causing some plaque development in your heart arteries. Just because skinny doesn't mean that they're going to have a plaque. And the other side of the coin is, my biggest patient I've ever done an angiogram was 518 pounds. His arteries were clean. So just because somebody is obese doesn't mean that they're going to have a plaque either. So it goes both ways. So you can have a plaque which could be developing at a young age, especially if you have a family history, that could potentially increase your risk of developing the blockages over the time. In the United States, number one cause of death is the heart disease. About 700,000 people die. So about 400,000 people die at home because of the cardiac arrest, and only 10% of the people survive. So that is the one reason for us to take care of ourselves with learning the CPR and also having a defibrillator in the neighborhood. I think in Atlanta, there is a study going on where a lot of lay people, they'll be trained to use the defibrillator so that if somebody have a cardiac arrest in my neighborhood, I have the best chance of going there and having a defibrillator using, so their chance of survival goes higher. So if you get an opportunity to learn about the defibrillator or AED, so use the defibrillator, which doesn't cost that much. It's about $1,000. So we spend so much money, especially if somebody has a heart disease, nice to have a defibrillator at home. So coming to the heart cardiac death, number one, as I said, is blockages. But there are other things which you need to be concerned about too. Cardiomyopathy, which is the heart muscle problem. During the COVID, we have seen a lot of heart muscle weakness, and sometimes it happens because of the viral infection. Sometimes it's because of a lot of other reasons, but whatever the reason is, if somebody has a weak heart muscle or a thick heart muscle, their risk of sudden death goes a little higher. Some people are born with an electrical problem in their heart called a long QT syndrome or a WPW syndrome or Brugada syndrome. Those people have a little bit higher chance of having a sudden cardiac death because of their electrical abnormalities. Like Murthy garu cheppinattu, it could be hyperkalemia. Some people have a hypotassium, especially people with the kidney problems. That could potentially make them have a cardiac arrest. And some people have a structural heart disease, like a valvular heart disease. Sometimes as we get older, or whether you're born with a defective kind of a valve, our aortic valve, which is the main valve coming out of the ventricle, can get smaller, causing the stenosis, and that also can cause, especially when it gets severe, can cause some sudden death. I'm going to switch gears a little bit to tell why South Asians, especially Indians, have 3 to 5 times more heart disease than Americans. So we have a lot more insulin resistance than non-South Asians. So I just want to give you one statistic, which is kind of amazing to me when I read about it. So South Asians represent 25% of the world population. If you take all the heart disease, we represent 60% of the world heart disease in South Asian. So it's that much more prevalent. So we represent 25% of the population. But if you take a heart disease, we represent 60% of the heart disease in the world. So it's that much more common. So some reasons we can take care of it, some we cannot. So second part of it is the visceral fat I told you about, thin outside, fat inside, which is not a good thing. So there is a little bit of metabolic issues, kind of more inflammation in the body. So it also can cause it. Our arteries are a little smaller. Our good cholesterol, HDL, should be high, but you rarely have a good cholesterol over 40 in a lot of South Asians. So our good cholesterol, which is like a scavenger. So if you form a plaque, which is the LDL, putting the plaque into the heart arteries, HDL, the good cholesterol, is a scavenger, is cleaning it up. But if your good cholesterol is low, so your bad cholesterol is keep putting the plaque, but you're not able to take it out. So it slowly builds up more and more. So it's very important to increase our good cholesterol. Exercise is the main reason how you can increase the good cholesterol. So you need to make an effort to do the good cholesterol to increase as much as possible. I think also Dr. Murthy said a little bit about the lipoprotein little a, which is a very highly thrombotic and a highly atherogenic. What that means is this particle, when it's in our blood, which is a lipoprotein little a, which is one part of the bad cholesterol, when it's increased in our system, if it's more than 50, and in India, sometimes they have more than 75, higher the number, your chance of plaque formation goes higher, and the chance of plaque rupture and forming the blood clot goes higher. So there are not that many things you can do right now to decrease the lipoprotein little a, but there are some new drugs coming out, and hopefully that would change our risk factors to go down a little bit so that we will have a little bit better kind of a prognosis with these. And coming to why we get more delayed screening. So we don't get like, as I said, we're more reactive kind of a society in general. So we wait for the symptoms. We don't wait for just have a proactive way of what's my cholesterol. Every one of us at 20 and above, we should know what your HDL is, what your LDL is, and what your lipoprotein little a is, what your blood sugars are. Just because you're skinny doesn't mean that your insulin resistance is not going to be okay. So you still need to get your hemoglobin A1C checked. By doing all that, I think we would know the risk factors a lot earlier. One thing about the risk factor, apart from the hypertension, diabetes, high cholesterol, history of smoking, so all those are risk factors. So there are some risk factors we can change, some we cannot change. There are some correctable risk factors. There are some non-correctable risk factors. So like age, you can't correct it. We all have to go get older. So as we get older, our risk gets higher. So, but postmenopausal state for women, they get more risk after the menopause, and getting the family history, those you cannot change. But if you control other risk factors like hypertension, diabetes, cholesterol, not to smoke, exercise, good diet, so that will decrease our risk by 70%. Remember that number. By controlling what you can control, you can decrease the risk by 70%. So I try to concentrate on what I can do with the 70%. Don't worry about the family history. If you have a family history, you still need to have it checked, but that you cannot change it. But try to not to smoke, exercise regularly. That will get you the diagnosis. So what we can do from now on, what I can suggest for South Asians, as I said, lipid panel early. Get your A1C, even if it's a BMI is normal. Our BMI should be a lot lower than Caucasians or other races. So I like the BMI for Asians to be less than 22, 23. That will, because once you get more than 20 to 23, your BMI, that is increasing your risk significantly. Get a calcium score, which is the simplest test you can get. If you're 40 and above, get a calcium score. It's a $99 test. Any of your primary care physicians can get it. So by using a calcium score, it will tell you if there is any plaque built up. It doesn't tell you how much the plaque is, what is your risk, but once you know that there is a plaque forming, majority of the people, the soft plaque becomes calcified, which is very easy to find. One picture takes 2 minutes to take the calcium score. One CT scan, one picture. If there is a calcium in your heart arteries, that shows that there is already plaque. Whether you have symptoms or not, doesn't matter. So your risk goes higher and higher as the plaque becoming more and more. So because the more plaque you have, more chance of rupture. More rupture, that means the heart attack. So once you know that there is the plaque developing, your mindset changes. So if I tell people that, hey, you need to exercise, they may not exercise. But once I show them that you're already forming the plaque, your chance of exercising, your chance of following the diet, your chance of taking the risk factors gets a lot better. But $100 test, you can take care of whether you have any issue going on with the heart or not. The newer test called a CT angiography, which is the cardiac CTA, what we call, where we inject the contrast into the vein and take the pictures of the heart. That will show both the soft plaque and the hard plaque. So sometimes calcium score does not show the heart, only hard plaque, not the soft plaque. So by having the CT angio, especially if you have a strong family history or if you're having the symptoms, it's about, in Atlanta, we do it for like about $800. And if you go to India, they do it for like 5,000 to 6,000 rupees. Having a CT angio will give you exactly what your risk is, where the plaque is, how much the plaque is, and if it's 20% or 50%. We do not do anything from like a stenting or the bypasses until the blockage becomes 70% or more. People do not get the symptoms like a chest pain, tightness, pressure, heaviness, going into the arm, going into the jaw, until the blockage becomes 70 to 80% or more. Even at 70 to 80% level, you only get the symptoms when you're exercising. If you do get exercise-related symptoms, every time I walk up the hill or every time I'm going up the stairs, I'm having a tightness or pressure, gundalo, like a baruga anpistundi, advanti symptoms vastay, especially if you get the sweaty, nauseous, with the chest pain lasting more than 15 to 20 minutes, please do go to the ER, because that could be heart attack. If you're having these symptoms, especially with nausea, vomitings, sweating. Sweating is a bad thing. That's one thing you need to remember. If you forget about everything about what I'm telling you, remember one thing: tightness, pressure, heaviness, with sweaty, nausea, more than 10 to 15 minutes, go to the hospital. Until proven otherwise, that could be heart attack. Time is money. Time is muscle in this kind of a scenario. So longer you wait with the chest pain, so you're having the muscle damage. More muscle you damage, you get consequences, and your chance of going into cardiac arrest with a ventricular fibrillation or tachycardia goes higher. So if you call 911, if you go to the heart, the specialty hospital, where we can go in, we can put a catheter in, find out where the plaque is. By EKG, we can tell whether the heart attack is happening or not at the time. And then we can take him to the cath lab, and you can open up the artery within like 30 minutes to 1 hour time. So that saves the muscle, that saves the risk of having a future complications. Exercise. To me, I think we need to spend 30 to 40 minutes every day, if possible, every day. So I try to do 10,000 steps every day. So that's my goal every day. By doing a 30 to 40 minutes of exercise, you're trying to increase your exercise tolerance. If you get any symptoms, you would know. Your risk factors for the hypertension, diabetes, cholesterol, all of them will go down. So 30 to 40 minutes, and then the low fat diet. Those two things will protect you for free. You can do it. You don't need anybody's help. By doing those two things, you can not to give the business to the cardiologist. I always tell them, so if you take care of yourself, you don't need to give us any business. So please take care of yourself so that you don't need to be getting into the situation of having a plaque formation. Coming to the LDL, the cholesterol, the bad cholesterol or the LDL is for Indians, I like to keep it under 60. And almost like you need to treat the Indian or South Asian like you already have a disease, blockages. So by decreasing the LDL, you're decreasing the chance of the plaque formation, you're decreasing the chance of the plaque rupture. My threshold for using the statins, I know side effects are there with any medications, but statins protect you by decreasing the progression and by decreasing the plaque rupture. Both ways, it will protect. So there's some myths about the heart disease. I'm a vegetarian, I'm safe. Not true. High carbohydrate diets increase the insulin resistance, and there were studies done both in India, UK, and United States. Recently, the studies came out, the second part of the study called Masala study. I think Dr. Murthy knows very well about it. It was done in Chicago, but not all over the country, but mainly in Chicago, as recently published by Dr. Kandula. So which tells us that by having Indian genes, they're really bad genes, so you need to take care of it. High insulin resistance, hypertension is more common, low HDL. So we as South Asians, we need to take care of ourselves. I'm not overweight, I told you about it. No family history means no risk. That's also a myth, but if you have a family history, definitely I'll be more aggressive. Some people say, oh, I have stress. We try to substantiate our symptoms with, oh, it could be acid reflux, or I have a lot of stress, that's the reason why I'm causing it. Most of the time, there are risk factors. Plaque is already forming. Stress can cause the plaque rupture more so than when you're not stressed out. But stress is not causing the blockage directly. So all these risk factors are the ones causing the plaque over the time, and then suddenly stress can cause the plaque rupture. And sometimes it just happens. You cannot control it. We cannot control the plaque rupture. Whatever we find out, we have a risk factors like viral infection can increase it. We are a smoker. By smoking, you can increase the plaque rupture risk. But we don't know all the reasons why some plaques rupture, some plaques don't rupture. There is a thing called a unstable plaque. Those are the plaque we cannot identify right now, but there are studies going on to see if we can identify what we call an unstable or a vulnerable plaque. If you can identify the vulnerable plaque and if you can stent it or we can take care of it, that may decrease the risk in the future. But right now, there is no ideal way of identifying that plaque. So you need to assume that every plaque is vulnerable. So coming to my end, so key takeaways, what I want you to remember. Sudden cardiac death is often preventable by taking care of it. South Asians are biologically predisposed to have a higher risk, so you need to take care of yourself. Early screening saves lives. Lifestyle plus medical therapy works. Do not wait for the symptoms. In closing, I just want to say one thing. To me, there are multiple things: financial health, physical health, mental health, spiritual health. So we, as immigrants are coming as an NRIs, we want to take care of our financial health more so than our physical health, mental health, and spiritual health until late in our lives. I think we need to take care of our physical health, mental health first, so that we can have a good kind of a health, good quality of life for the future. I want to comment about the women and the heart disease. I think Dr. Murthy commented about it. So we have, I think I'll say this in a good way. Women have this problem of taking care of everybody else except themselves. I think especially Indian women have that more so than a lot of women I have seen. So I think women, especially Indian women, need to be a little bit more selfish about themselves, take care of themselves rather than thinking about their spouse, children, parents, brothers, sisters. All are important, but you need to take care of yourself a lot more. You need to be a little bit more selfish about getting your stress test done, getting your risk factor modification, getting your testing done so that you will be helpful for the whole family. As a primary member of the caretaker in the family, I think we need to take care of our women. So if your guys take care of your women, your mothers, your sisters, your wives, I think you need to protect them by suggesting them to get their testing done. Last and final, so goal is not to just live longer, is to live healthier without that unexpected phone call that we don't want to hear, that changes the family forever, that somebody had a sudden death or a cardiac arrest. So please do take care of yourself by controlling the risk factors. So hopefully you do not need to have a cardiologist doing a procedure on you, but I think take care of yourself so that we will have a healthy Indian population, healthy Telugu population going into their 80s and 90s, so that we can enjoy fruits of our labor, what we worked throughout our younger life. Thank you.
Thank you so much, Andy. Srini Ganesani garu, thank you so much, and Murthy garu, thank you so much.
Really I want to thank, Srini Gangasani garu, he is talking out of his years of experience, One thing I want all of you to remember, the word epigenetics. So this is a new buzzword. It has been there for 10, 15 years. Epigenetics means, see, we know that some of the conditions, including the heart disease and all that, they're genetically transmitted. Epigenetics is the word we use, and we are trying to conduct some of the studies in India and here. It is a term which specifically relates to the behavior we call gene expression, the behavior of the genes as opposed to the structure of the genes. Your whole thing, your whole life is guided by the DNA, the genes, and that some of them is inherited. You can't change it, as Dr. Gangasani was saying, But epigenetics, majority of the factors that involve epigenetics, majority are reversible. What is the latest example? Besides the stress, you can control the stress. Well, it's easy for us to say, okay, that is an epigenetic factor. Your diet, you can control your diet. That is an epigenetic factor. Now, recently, we know there is a significant research going on. Environmental pollution is one of the major epigenetic factors we underappreciate. If you are living in a city where the air pollution index is terrible, the chances of you getting heart attack, sudden cardiac arrest, heart attack initially, and then sudden cardiac arrest are much more. And this is a very, very important scientific thing, that people are trying to understand. Just remember that these are all reversible things. If you are staying by the side of a factory, which is emitting, which is so many emissions. And so again, I'm not going to go into details, but I thought it's important to share this latest information. Thank you.
There's some questions about I can answer what are in the chat box while you're getting I think Pranati, or I think Pranati, you want to go, or you want me to answer the ones in the box?
Absolutely. I have a lot of questions apart from the box. So I am ready. First of all, if you are, Uma Garu, is that the plan? Should I go with the questions that we have received earlier, and then we can start with the chat?
మనకి ఫస్ట్ వచ్చి కదమ్మా, ఫస్ట్ వచ్చే క్వశ్చన్స్ మనం మీరు చదవండి. Experts will answer. Later we will take that chat questions also.
Okay, sure. Sounds good. Before in questions ki velleg mundu, I have to say both in English and Telugu, so I'll repeat both. Heart disease is a topic that is very close to everybody's heart and affects every family. Personally, everybody might think kadandi, nenu indaka meer start chesinappudu AI generation, Gen Z, millennials, ekkada chusina information is available everywhere. But why is this session so important? There are a lot of ifs and buts. ఒక క్వశ్చన్ అడిగితే 10 ఆన్సర్లు వస్తాయి. ఏది కరెక్టో తెలియదు, క్లారిటీ ఉండదు, డెప్త్ ఉండదు. బట్ ద వే యూ ఆన్సర్ టుడే, పర్సనలీ ఐ వాజ్ సో టచ్డ్. లాట్ ఆఫ్ ఇన్ఫర్మేషన్, వెరీ వాల్యుబుల్, వెరీ మీనింగ్ఫుల్. ఆ డెప్త్ కానీ, ఆ రీఅష్యూరెన్స్ కానీ, దిస్ ఇస్ వాట్ యూ షుడ్ డూ, దిస్ ఇస్ ద డైరెక్షన్ దట్ యూ హ్యావ్ టు గో, దిస్ ఇస్ సంథింగ్ దట్ వీ కెన్ ఓన్లీ గెట్ ఫ్రమ్ ఎక్స్పర్ట్స్ లైక్ యూ. So this session is truly meaningful and priceless. Thank you, Murthy Garu and Srini Garu. I personally liked your comment about women start being selfish. Super. అసలు నిజంగా సెల్ఫిష్గా ఉండాలి and we should start thinking about ourselves and then we can build a better community. So that was amazing. With that, without any further ado, I'll jump into the questions that we have received from audience. ఇంతకు ముందు వచ్చాయండి చాట్లో. I think I'll keep both English and Telugu. You must have already repeated this, but I'll still ask the same questions. So we have received a bunch of them. I categorized them into different sections. I'll start with women and menopause because naka topic close to my heart kavati. I'll start with that. We often hear that women are protected from heart disease until menopause. Is it really true? Adi menopause tarvata increase avutunda lekapothe what precautions should really women take after menopause?
So that's true. Hormones definitely protect until the menopause happens, but
Okay.
they really catch up pretty fast after the menopause with guys. So men have a higher heart disease at a young age, but women are protected until the menopause. But if you take all comers, heart disease is still the most common reason for death in women also. By far, next to 5, breast cancer, cervical cancer, and all other things combined, it's still heart disease is the most common reason for death, even in women. So yeah, up to menopause, they're protected to some extent because of the hormones, but they catch up, but they still need to protect themselves with the diet, exercise, I think hypertension, high cholesterol. Those are still important because they're going to play a bigger role once the menopause protection, hormonal protection is gone after the menopause.
Thank you.
Yeah,
I'll
I may
move on
also add, Pranati, I may also add a couple of things, especially from the women's perspective, like pregnancy complications like preeclampsia and gestational diabetes, they're much more common, of course, in women only. So that will also contribute. And there is a research paper recently that I came across, autoimmune diseases like lupus or rheumatoid arthritis, they're more common in women, and they definitely also increase the cardiac risk. Thank you.
Thank you so much. I'll move on to the next question, Andy. This is about family history and genetics. See, for example, if someone's father had a bypass surgery at the age of 50, does that significantly increase their risk? Ante ipudu oka family lo okaliki hereditary valla undi. What preventive steps should these individuals with strong family history should be taking? How important is this lipoprotein testing in these cases?
So that's a good question. I think family history is very important. Not everybody in the family gets it because somebody has it, but it definitely increases their risk significantly. We still don't know the exact the transmission. Not everybody gets it for sure, but majority people have that gene expression. So by doing everything correctly, you can decrease the risk still. But those are the people need to have it checked sooner than later, either the calcium score or CT angio or a stress test, something so that they know that whether they got it or not. I have multiple family members in the family. So out of the 4 kids in the family, 3 of them have a blockages, stents, and then 1 that doesn't have any plaque at all. In fact, actually last week I was in the hospital rotation. So I had one lady came in, she had all 3 brothers have stents already. Her parents have it, and symptoms were so atypical. She was like, I have some muscle pain here. I don't think it's the heart, but because of the family history, I came in. I said, you have such a strong family history. I want you to do a CT angio, because symptom point of view, I wouldn't have done it because our symptoms were very atypical. But just because of the strong families, I said, I want you to do the CT angio. It so happened that all 3 arteries had blockages. So she's going to have a bypass surgery on Monday because of all 3 arteries are blocked. Our symptoms are so atypical, but the only reason for me to go for a CT angio because you came into the hospital with some atypical, it's a female. So females women have a little bit of atypical symptoms and strong family history. I want you to, and she's only like 50. So she's not that old. So, but because of the family history, I said, I cannot let you go home. I need to have a test where I can safely say there is no blockages. So I did a CT angio. She had all 3 arteries have blockages. So she's going for a bypass surgery this week.
So again, to your point, prevention is better than cure, being proactive than reactive. Lucky she came at the time.
Family history, there is nothing you can do about it. That is one of those uncontrollable risk factor. So you need to try to control all other things. So if, for example, if you have a family history, it happens, a lot of Caucasians come to me and say, oh, my father had a 50 had a heart attack, but he was a smoker, he was obese, and so that definitely contributes to it, but that should not make a 50-year-old get the heart disease either if he didn't have a bad genes. So I think family history contributes to it, but the risk factors also contribute. So as I said, 70% of the risk, you can decrease it by controlling everything else, but 30% you cannot control it. So you need to be on that 70%, whatever you can do, so that, you know, if you're going on a highway, somebody can come and hit us. There's nothing you can do about it. I won't worry about other people. I worry about me. If I'm not drunk, if I'm not going playing on the phone, my chance of having an accident is a lot lower. So I try to control what I can control. I don't worry about the things which not in our hands. Getting older, you can control. Family history, you can control, but control what you can control.
That makes perfect sense. Yep. Moving on to next question. It's about the cholesterol, calcium scores, and blockages. If someone has high cholesterol, how aggressively should it be managed? What does a high calcium score really mean? Say, for example, oka calcium score 400 undi, diabetes elevated ga undi. And how do we determine if any blockages unnaya, or do we have to go for a CT angiogram or invasive angiogram? How do we determine that? Does calcium scores have anything to do with?
Yeah, the calcium score, once it's more than 0, means that there is a plaque already. So you want it to be 0. Okay, 0 is the best. That means that there is no calcified plaque. It still doesn't mean that there is no plaque. It only says there is no calcified plaque. Okay, so up to 100 is mild, 100 to 400 is intermediate, over 400 is high. I have patients with a calcium score of 5,000. Okay, that is my maximum I have seen is 8,000. So I have patients with a calcium score of 1.5, had a 99% blockage because most of that person's plaque was soft plaque. So it was very minimal hard plaque. So that means that not everybody with a plaque need to have a lot bigger number. I also have patients with a calcium score of 3,000. He had an angiogram so far 3 times. None of the blockages are more than 50%. So number does not give you the percentage. Number gives you that there is a plaque built up in your system. So it doesn't give you, as I said, I have a calcium score of 1.5 at a 99% blockage. So that's most of it is soft plaque. So there is a soft plaque and a hard plaque. CT angio shows both the plaques, soft and hard. Calcium score only shows the hard plaque. But that once you have a hard plaque, you know that you already have a soft plaque also, because it forms as a soft plaque. It takes probably 4 to 5 years before it becomes calcifies. So that is the difference between the calcium score and the CT angio, what you need to do about it. If you have a calcium score elevation, what I do is I would definitely do either a CT angio or a stress test. So this is where the stress test comes into picture. I know I saw a couple of questions on the chat. So stress test only shows if the plaque is over 70%. So you don't get the symptoms until you're 70% or more. So if the calcium score is 400, but your CT stress test is normal, that means that you have a plaque, but not bad enough to cause the symptoms. That doesn't mean that your risk of heart attack is going down. But at least right now, if you're having a chest pain, if your stress test is normal, that means that the plaque which is there is not causing your symptoms. So that's the way it goes. The stress test shows only over 70% or more blockage. So if the calcium score is elevated, if your stress test is normal, that means that your plaque is probably under 70%. The one note about the stress testing is only correct 80 to 85% of the time. So 15 to 20% it can be wrong, especially somebody who has all 3 arteries have blockages. That's what we call a balanced ischemia. So there's nothing to compare to, especially the nuclear stress test. We see it all the time. Stress test is, my stress test was normal. Now I'm going for a bypass surgery because all 3 arteries have blockages. So when we look at the pictures, everything looks little down, but nothing really, one area looks abnormal. So sometimes people call it normal because of the balanced ischemia. That's what we call, because there's nothing normal to compare to. So just don't give too much importance to the stress test if you're having the symptoms. If you don't have the symptoms, you're feeling fine, your stress test is normal, your calcium score is 0, that's perfect. That's what you would want. But if your calcium score is elevated, if your stress test is normal, if you're not having any symptoms, that's great. But if you're having symptoms, go to the CT angio or a catheterization. Catheterization, which is an invasive test, which is 100%. You don't need to have everybody. But if I think they're a high-risk patient, I would go for an angiogram. If my risk is high probability, I'll go to the CT or a catheterization. If my risk is intermediate probability, then I'll go to the stress test. That's how we decide when somebody comes to the office, which test we need to do. All of them there is some place in our what we can do, but not one. But if you want to do just one test done, CT angio is the way to go right now.
మీరు ఇచ్చిన ఆన్సర్ సీరియస్‌గా నేను చెప్పాలంటే, యాస్ ఎ పేషెంట్‌గా నేనొచ్చి ఒక డాక్టర్ దగ్గరికి ఒక 10 సార్లు విజిట్‌కెళ్తే ఒక ఆన్సర్‌ని ఒక 2, 3 నిమిషాల్లో చెప్పేశారు. 10 సార్లు వెళ్ళి ఈ టెస్ట్ తర్వాత, ఆ టెస్ట్ తర్వాత, ఆ టెస్ట్. నాకొక కాల్‌లో చెప్పారు. దిస్ ఈస్ రియల్లీ వాల్యుబుల్ సెషన్. మూవింగ్ ఆన్ టు మై నెక్స్ట్ క్వెషన్. కమింగ్ టు సిమ్ప్టమ్స్ అండ్ సైలెంట్ వార్నింగ్ సైన్స్. వాట్ ఆర్ ద ఎర్లీ సైన్స్ ఆఫ్ అ హార్ట్ అటాక్ దట్ పీపుల్ రియల్లీ ఇగ్నోర్? క్యాన్ దిస్ హ్యాపెన్? అసలు హార్ట్ అటాక్ వచ్చినప్పుడు చెస్ట్ పెయినే లేకుండా రావచ్చా? హౌ కెన్ దే రియల్లీ కొంతమంది చెప్తూ ఉంటారు. ఇది హార్ట్ అటాకో, ఎస్‌డిటియో నాకు తెలియట్లేదండి. ఐ డోంట్ నో. వాట్ షుడ్ బి ఎ వార్నింగ్ సైన్ and what should not be ignored?
సో టిపికల్ సిమ్టమ్స్ అంటే టైట్నెస్, ప్రెషర్, బరువుగా ఉన్నట్టుండి, రేడియేటింగ్ టు ద జా, సో గెటింగ్ స్వెటీ, నాషియస్, దట్ ఈస్ ద టిపికల్ సిమ్టమ్. Okay, but people with the diabetes, because of their some damage to their nerves or a long-standing hypertension, so they may not have the typical symptoms of the chest pain because their nervous system cannot send the message to the brain that there is something is going on with the heart. So some people can produce fatigue, just I feel tired, I don't feel good today, and then get sweaty, nauseous. I think, as I said before, if you get sweaty with any kind of symptoms, if you don't have a clear explanation, I think you should get it checked, especially if you have diabetes, especially long-standing diabetes. Are you feeling tired? I'm not feeling good, but I'm getting sweaty. I'm feeling short of breath is the second most common symptom after the tightness and pressure. Every time I walk, I could have done one flight of stairs before. ఇప్పుడు ఒక ఫ్లైట్ వెళ్తేనే నాకు ఆయాసం ఎక్కువ అవుతుంది, ఇంకా ఎందుకు తెలియట్లేదు. ఆయాసం మీకు న్యూమోనియా లాగా వచ్చి ఆయాసం వస్తుందంటే దట్స్ ఓకే. బట్ ఇఫ్ యూ డోంట్ హ్యావ్ ఎ క్లియర్ ఎక్స్ప్లెనేషన్ ఫర్ యువర్ సిమ్టమ్స్, ఎస్పెషల్లీ consistently happening with exertion, you need to have it checked. Heart attack, most of the time associated with the sweating, nausea, and it's continuous. Anytime if you get a symptom, any of these symptoms continuous for 15 to 20 minutes, you should get it checked rather than leaving it alone. Better safe than sorry. I would rather see 7 or 8 people coming into the ER or to the office without having an issue, but I don't want to miss those 2 people who can have a bad complications if they're really having a heart attack or having a blockage.
Yeah,
Yes.
Pranti garu.
చెప్పండి మూర్తి గారు.
This is a very sad story that recently happened a few days ago. I just want to bring attention to everybody, when you're talking about the symptoms. This is one of the regional medical officers in Andhra Pradesh. He saw his patients. He's a wonderful person, gave the instructions. Then he felt some kind of burning sensation and deep-seated discomfort in the chest. So immediately, because he's a physician, he's checked his EKG. It was normal. However, he took the afternoon off. He was driving and he succumbed to sudden cardiac arrest. So I think Dr. Srini Gangasani will also comment, just because you have a normal EKG doesn't mean you're not having a heart attack. I just want to bring to your attention, again, as Dr. Srini Garu cheppinattu, you have to look at the whole picture. Don't read the numbers. Numbers don't mean anything. EKG doesn't mean anything. Because if you are having a heart attack and if your EKG shows normal, and if you resume the thing, and the next is a disaster. Dr. Srini Garu, what do you think about it?
Absolutely. So a lot of people, especially మనకు సో యాసిడ్ రిఫ్లెక్స్ ఇష్యూ చాలా ఎక్కువ ఉంటాయి ఇండియన్స్లో. సో లాట్ ఆఫ్ పీపుల్ అజ్యూమ్ దట్ నాకు ఆ స్టమక్ కొద్దిగా అప్సెట్ అయింది యాసిడ్. సో సమ్ టైమ్స్ రైట్ కోronary artery is also like in the bottom portion of the heart. It supplies some of the areas where it can mimic the GI symptoms. So more often than not, if it's like a main artery in the front of the heart, they may get chest pain, tightness. But if you have circumflex or RCA blockages, they may have more GI kind of symptoms. So don't neglect if it continues. Or if you're in doubt, get it checked rather than ignoring it, because consequences could be bad. I know a friend of mine who is a doctor, who was a doctor. He was a sports person, okay? So he was a very well-known sports person, and still he was having chest pain, ignored it because he had some issue, family function going on, and suddenly collapsed and died, unfortunately, at the age of 50 in Hyderabad. So I think those are I think if you're in doubt, I think you need to get it checked rather than ignoring it. Ignorance is, I think, is a big issue in these kind of situations.
Yeah, thank you, Murthy Garu and Srini Garu. Thank you for sharing the insights. I think repeatedly what we're hearing is it's important not to neglect anything. Be proactive, get it checked. You have nothing to lose. And have a healthy diet, healthy lifestyle. మీరు డాక్టర్ దగ్గరికి రమ్మని చెప్పట్లేదు, డాక్టర్ దగ్గరికి రాకుండా ఏం చేయాలో చెప్తున్నారు, రైట్? That
That's
is
the
most important takeaway that we should take away from this call for everyone on this call. And I think this should be a message to be communicated to the broader audience too.
నేను
All
నేను యాజ్ జోక్ గా చెప్తాను నా పేషెంట్స్ తోని. సో ఎందుకు నువ్వు ట్రైంగ్ టు గివ్ మీ మోర్ బిజినెస్? సో యు నాట్ డూయింగ్ ఎవ్రీథింగ్ రైట్. కొలెస్ట్రాల్ ఇస్ స్టిల్ హై. వై ఆర్ యు ట్రైంగ్ టు గివ్ మీ మోర్ బిజినెస్? ఐ యామ్ ఓకే. సో డోంట్ గివ్ మీ ద బిజినెస్, గో టేక్ కేర్ ఆఫ్ యువర్ సెల్ఫ్ అని చెప్తుంటాను జోక్.
అది యూజువల్లీ సెషన్స్ ఎలా ఉంటాయంటే, సిమ్టమ్స్ ఎలా ప్రివెంట్ చేసుకోవాలి, ఎలా ఉండాలి, మా దగ్గరికి రాకండి, మీరు బాగుంటే మా దగ్గరికి రావక్కర్లేదు అనే సెషన్ ఇది. ఇట్స్ ఇంట్రెస్టింగ్ అండి. నైస్. మూవింగ్ ఆన్ టు ద నెక్స్ట్ క్వశ్చన్. వై ఇస్ దిస్ సిమ్టమ్స్ అంటే హార్ట్ అటాక్స్ ఎందుకు యంగ్ ఇండివిజువల్స్ లోనే ఎక్కువ అవుతున్నాయి? ఎట్ వాట్ ఏజ్ వి షుడ్ రియలీ స్టార్ట్ మానిటరింగ్ దిస్ హార్ట్ హెల్త్? ఆర్ ఏవైనా రొటీన్ టెస్ట్లు ఉన్నాయా అడల్ట్స్ కి కానీ లేకపోతే కిడ్స్ కి కానీ మనం కన్సిడర్ చేయవలసినవి? హౌ మచ్ స్ట్రెస్? ఇప్పుడు అందరం ఐటీ వరల్డ్ తీసుకోండి, ఏ వరల్డ్ తీసుకున్నా, ఈవెన్ ఒక కిండర్ గార్డెన్ అడిగినా ఐఎమ్ సో స్ట్రెస్డ్, ఐ హ్యావ్ సో మెనీ వర్క్స్ టు డూ అంటారు. ఈవెన్ ప్లే డేట్ కు కూడా వాళ్ళు స్ట్రెస్ గా ఫీల్ అవుతున్నారు. సో ఇన్ దిస్ కైండ్ ఆఫ్ వరల్డ్, హౌ మచ్ డస్ దిస్ స్ట్రెస్ కాంట్రిబ్యూట్ టు హార్ట్ డిసీజ్? ఇట్స్ అ లోడెడ్ క్వశ్చన్. ఐ ఆస్క్డ్ యూ మెనీ ఇన్ వన్ థింగ్.
సో రిస్క్ ఫ్యాక్టర్స్ ఇంతకుముందు కంటే ఏం చేంజ్ కాలేదు. కాకపోతే మనం చిన్నప్పుడు చూసుకుంటే ఐ యూస్ టు గో టు వాక్ టు వర్క్, బైసికల్ టు ద కాలేజ్. సో అప్పుడు చూసుకుంటే ఈవెన్ మెడికల్ స్కూల్లో కూడా వీ యూస్ టు వాక్ ఇన్ కర్నూల్ ఫ్రమ్ మై హాస్టల్ టు ది మెడికల్ స్కూల్ వీ యూస్ టు వాక్. సో అప్పుడున్న ఎక్సర్సైజ్కు ఇప్పుడున్న ఎక్సర్సైజ్ తగ్గింది. ఓకే, రిస్క్ ఫ్యాక్టర్స్ ఎందుకంటే మన లైఫ్ స్టైల్స్ చేంజ్ అయిపోయినాయి. మోర్ ఐటీ వర్సెస్ వాట్ ఫిజికల్ వర్క్ ఉండేది. ఇప్పుడు ఫిజికల్ వర్క్ అంటే కూడా మనం మోర్ మెకానికల్ వర్క్. సో ద వన్ థింగ్, మెకనైజేషన్ అండ్ కంప్యూటరైజేషన్ is killing more Indians than before, and having McDonald's, KFC kind of a diet killing more Indians. So we are already more prone to have the disease. Now we are having more bad diet with the McDonald's, KFCs and coming to India, and then our activity level has gone down. So our stress level has gone up. Definitely, like you said, I think there are a lot more like the ITA కావచ్చు, లేకపోతే ఫ్రమ్ ద చైల్డ్హుడ్ కావచ్చు, putting more stress on people just because the environment is a fast-paced environment now. So then I also say this as a joking to the patients, don't take stress, give stress. So I don't take stress. If somebody wants to give me stress, I said, no, thank you, I don't want it. So because it's all, stress is not given by somebody. Stress is how you react. Stress is not because somebody is giving you. The stress is how you're reacting to the problem. You can react to the problem in multiple ways. So I try to react in an easier way. So because it's something I don't control, I don't worry about that stress. If I can do something about it, I'll do something about it. So that is the way you need to start looking at it. So I think that I always tell the patients that stress is not causing you anything. You're reacting and causing your stress by yourself, not somebody else is not. Don't blame anybody else. It's our reaction is what causing our problem, not somebody else is giving us the stress.
Very good way to say it, though it's hard to accept, but that's the reality. Agreed. But why is it happening mostly in the young individuals today? Is there a reason?
So I think these are the three reasons why, because if your cholesterol goes way higher, and smoking also has gone up significantly in younger people. Actually, older people is getting better. So I'll tell you one thing. Before 50, chance of the plaque rupture, if the plaque ruptures, your chance of having a heart attack and causing the sudden cardiac death is higher because you have not developed your own bypasses with the other arteries. So suddenly what happens when you have a heart attack is one plaque ruptures and forms a blockage 100%. So now there is no blood flow to that area of the muscle, which was getting blood flow like 2-3 minutes ago. Now heart can go into fibrillation really easily in younger people because there is no collaterals or bypasses. As you get older, after 50, because as you exercise more, you develop your own bypasses. So suddenly there is a plaque ruptures, your blockage causes the heart to not get enough blood flow, but other arteries start to give the blood. So those are the people, they're still having a heart attack, but they come to the hospital and we put a stent in and we can save them. Whereas the younger people in 20s, 30s, 40s, there is no that protective other artery bypasses giving that response. So that is the reason why before 50, the risk of sudden death is a lot higher, almost 3 to 5 times higher when somebody gets a heart attack before 50, the chance of dying versus after 50. So that was also, I was happy after 50, I said, yes, one goal happened. So I think the chance of sudden death went down after 50. So that is the reason. So the stress, the atherogenicity and thrombogenicity are the two things. Atherogenicity is the blockage formation. Thrombogenicity is the blood clot formation. So if you have a plaque already, by taking the cholesterol medication, it will decrease that risk. By taking the baby aspirin, that decrease the risk of the clot formation. So those are the kind of things, risk factors you need to take care of. So as I said, I think you were asking about a question about what you can do about it. If you have a
Yeah.
strong history, multiple risk factors, I think around 40 for males and 45 to 50 for females, get a calcium score. That is the simplest way I can get you just to know if there is something going on. If you do the stress test, that'll be useful. If you get the symptoms, stress test is more useful. But as a screening test, calcium score is the best. For $100, no dye, no contrast, just you go lie down 3 minutes, it'll be done. And it also tells you everything else what's going on in your chest. The lungs, the aorta. I found the lung cancers when I did the calcium score. I found the aortic root dilatation with the aneurysms. So there are a lot of other things. The fatty liver, which is getting more and more common in Indians. And fatty liver, we used to think is benign, but I've seen so many fatty liver, and that also kind of in the future can lead to a lot more liver complications too. So I think we can see a lot of the stuff. So if I test one test, calcium score around 40, or all Indians, will give you a lot of area of you can do the prevention kind of a thing to be more aggressive with your risk factors.
Yeah, Pranati garu, let me
Cheppanడి.
also bring to focus also when you're talking about stress, everything is stress.
Yes.
We are living we are leading a life of stress every minute, if not every second, and this is a part of the civilization and the progress. And it is sometimes it feels like it is indispensable. But the recent research, the yoga and meditation, definitely they have got some impact. I don't know too much about the research, but the research has clearly pointing to the fact. Now, how does it affect the meditation and yoga affect the heart per se, directly? Now, yoga definitely stimulates what is called the parasympathetic system. The parasympathetic system, the increased heart rate is dangerous to the heart. Why? The blood supply to the heart itself is impeded because the blood supply to the heart happens between the contractions where the coronary vessels dilate. Now, when there is increased heart rate, so like 120, 100, so it definitely depletes, the oxygen supply by not being able to provide enough circulation to the intrinsic part of the heart itself. Okay, now we have definitely some very encouraging evidence. Besides neuroplasticity, neuroplasticity is a term where we talk about the neural connections, the neural signals. It's not necessary, like memory loss, especially in cases like Alzheimer's, the memory loss and the centers, hippocampus and all that. There is some growing evidence that the yoga and meditation can contribute to an increased neuroplasticity. So here we are getting the double advantage of, actually taming the heart, as well as giving some kind of, the support, to the brain also, So I thought it is important. I'm sure, this is just in the initial stages, that the research is coming out. So I thought it's important to mention about that. Thank you.
No, absolutely. This is very helpful, Andy. I think you really answered the second question. The best practices, food in తీసుకోవాలి, is walking enough exercise to protect the heart, or fitness trackers actually useful? Indaka Srini garu answered చేశారు. If someone has a strong family history, what extra precautions we should take? So these questions have already been answered. So this is helpful. Moving on to the next one. If someone collapses, right, from cardiac arrest, how much time do we really realistically have to act? Somebody that,
As I'm immediately, what we call diamond minutes, golden minutes is just a language. As soon as the first thing you have to do is to call 911. Don't touch the patient. Don't when first confirm that this person is not moving, is not breathing, and completely almost dead. Okay. And breathing means, sometimes, there is a hard breathing. That is gasping. That's not breathing. So even that happens, that means the patient is impending or already in the cardiac arrest. I just wanted to, as soon as possible, how much time do you take? Firstly, emotional things. When something happens to, brother or sister or father or husband, the emotional component is the one that inhibits us to take action immediately. Okay. It is easy for me to say, oh, well, call 911 immediately. So that is the emotional component, is something that we really need to think about ahead. If something happens to me, I should tell my wife, or, what should do? Yeah, emotional thing is very important to, and I mean, very difficult to control. Call 911. And how much time does it take? You can say, well, we have a sudden cardiac. I think, my husband collapsed, my wife collapsed. Please come to this address, 111 Washington Street, whatever it is. And just make sure the door is open. And then immediately start compressions after bringing the patient, putting something in the bag. And again, we are not prepared to do this unless, there is, unless we do rehearsals. We do rehearsals for the medical students. What happens, when there is something impending? You don't go at the last minute without preparation. So the question to, the answer to that, the question is as soon as possible. But if you are not given any kind of hands-on CPR, even hands-on CPR in the first 4 to 5 minutes, as I mentioned, the brain is going to die. After 5 minutes, at the rate of, again, the cost of repetition, 10% on an average per minute after 5 minutes.
But I think the time is a brain function. So longer you wait, your chance of brain recovery, even though heart may come back, but brain may not work. So that is a brain death is the death. So we have patients who have heart is back, but brain never came back because they didn't have a CPR on time. So sooner we can get the CPR started, that will save their brain tissue. So we can get the heart back later on, but if the brain is dead, it's like, so depends on the age, 5 to 10 minutes. I think after 10 minutes, the chance of recovery of the brain goes down significantly.
Yeah, so as soon as possible. There is nothing like 5 seconds wait here, 10 seconds kadu. As soon as possible. React immediately. Understood. Now I'll move on to the questions in the chat, Andy. Is TMT enough to check for blockages, or do we need another test?
Yeah, I just put the answer in there, but I think so. Yeah, TMT is correct 70% of the time. So different kind of a stress test we do. So one is the TMT or exercise treadmill test, where you just walk on a treadmill so that we can look at the EKG to see how it changes. So the sensitivity and specificity is about 70% for that test. So that means 70% of them is correct, 30% of them can be wrong. So if we do the nuclear stress test or a stress echo, which we are adding a imaging to the walking, so that will increase the sensitivity and specificity to about 85%. So that 15% of them they're wrong, but 85% of them they're correct. So if you go to the catheterization, which is an angiogram where we go invasive, that is 100%. So in between now the CCTA or a CT angiography of the heart came out, which is about 95 to 98% accurate, depending on how much calcium is there. Sometimes there are a lot of calcium kind of makes it not to be able to see in behind the calcium in the CT angio, but if their calcium score is not that high, so those people, it's a sensitivity is very good. If in a normal heart, if it's normal, we can 100% say there is no plaque at all. But 5%, 3 to 5% of the time, if there's a lot of calcium, we cannot accurately say is it 50% or 80% or 90%. This test is not for people who already had a bypass or a stent, because it's kind of harder to see within the stent. So we're talking about these, we can still use it sometimes, but this is perfect for somebody who's having symptoms, but never had a stent, never had a bypass. It's a great test.
Thank you. Another question is walking enough, or only weightlifting helps in increasing HDL?
So walking is good. Any kind of exercise increases the HDL, any kind of exercise. The timing is more important than the intensity. For any kind of a cardiac, I'll always tell them, you do it your own pace, but do it longer rather than going fast and less, rather than timing is more important than the intensity. I would go long and go slow. If I go for 5 minutes, 5 miles an hour, but I can't go, that's not as protective as going for 30 minutes to get 3 miles an hour. I can go at my own pace. That's more protective to the heart.
My calcium test done more than 5 years ago and told 400. How often we can do it to see if it is reduced due to statins usage for the last 5 years, which is making my LDL in good range?
Okay. So once it's positive, once it's higher, it's not going down, because it's the calcification of the plaque. Here, unless there is something wrong with the machine or whether it almost always goes up. In fact, by using the cholesterol medications, the number may go higher. But as I said, number doesn't mean anything. So once it's positive, once it's more than 0, they already have a plaque. Either 2 or 2000, to me, is the same. They have a plaque. So I need to keep their LDL close to 50, HDL over 40, and then stress test every few years, depending on what their symptoms are, or CT angio now to see exactly where the plaque is. So calcium score, I won't repeat it unless, and some people want me or say just to see the progression, but it's not going to make any difference for what I want to do from a patient point of view. It's not going to make any difference. I don't repeat the calcium score if it is over 0. If it's 0, I repeat it in 5 years just to see if anything changed. But if it's more than 0, I don't repeat regularly.
Great. And how often should we get a CT angio?
The same thing depends on what we find on the CT angio. CT angio is completely normal. 5 years is a good timing. And if you get symptoms, you can do it sooner, but more often than not, because there is also radiation, there's also a contrast sometimes can affect the kidneys. So you got to look at the risk versus the benefit. I wouldn't repeat it unless there is a really a good reason to repeat it in 5 years. If you get the symptoms, yes, we can repeat it sooner. Because the other side of the coin is if I do the CT angio, if there is a 50% blockage, okay, then I may need to, if they get the symptoms, I may repeat it in 2 to 3 years to see whether that 50% now got into 80% or 90%. But if the CT angio showed the plaque was 0, and there's no reason to repeat it that soon.
Thank you. And another question, but I don't think the question was completely communicated. I got the pain in the middle of the chest as a cylinder gas burner on. Within seconds, I took aspirin and rested on the couch before 911 arrived. If the question is, am I okay, or what are the precautions should I take, or what should I be doing next? I don't know, but this was a question from Srinivas Garu.
So chest pain can be because of multiple reasons. Chest pain can be because of the muscles, nerves, the lungs, the esophagus, and the heart. But heart is the worst one. So if you have a continuous pain, or if you get the tightness, pressure with exertional activities and sitting down is going away, until proven otherwise, it could be heart, or it could be sometimes the lungs, because the bronchospasm also can cause it. If you're not doing anything, if you're lying down and you get the tightness and you just exercise, it goes away. It could be just acid coming into the chest, and that could be causing it. I cannot just go by one symptom that is true or not, but if it keeps happening, depending on the risk factors, depending on what your prior testing, that's what you need to go by. But any continuous pain of more than 5 to 10 minutes, you need to be cautious. If it goes more than 15 to 20 minutes, if it's associated with nausea, vomiting, sweating, get it checked. Relieved by aspirin doesn't mean anything. Maybe it would have gone either way. Aspirin will protect you to decrease the thrombus size if you're having a heart attack. Or also it's a painkiller. So if it's a musculoskeletal, it also can help. So both ways it helps.
Can the 75-year-old take a stress test, or just a CT angio is recommended for him?
You can do a stress test. I have 80-year-olds do the stress test. But I think it depends on what your symptoms are. So CT angio is an easier and more accurate test now. It was not approved until recently. Medicare just started to approve the CT angio last year. So even now, some of the private insurances don't approve it. So that is the reason why we used to do a lot more stress testing. But the CT now is available, it's more accurate. So we try to do it. But if somebody has a renal insufficiency, like somebody's creatinine is high, I won't do the CT angio because I can mess up the kidneys by giving the contrast. So I need to look at what is the best test for that person. But if everything being equal, 75-year-old, you can do a stress test or a CT angio. CT angio is 95% accurate. Stress test is about 85% accurate. So that is but depending on what is available, what the stress test is doable. If they cannot walk, we can do a medication stress test. Not everybody need to, I think I didn't say anything about the medication stress testing. Some people cannot walk because of their arthritis, or they're having some issues with the legs. So we can give there are 2 types of medications. One is called vasodilator medications, which is adenosine, Lexiscan, and Persantin, where we give the medication for 1 minute to 4 minutes, depending on what medication we're giving. That stresses the heart exactly like what we do when we're doing the treadmill. And then we take a picture before, we take a picture after, so that we can compare to the pictures before we gave the medicine, after they gave the medicine. That gives exactly same information like somebody's walking on the treadmill. Second is dobutamine, which increases the heart rate and the contractility of the heart. So that sometimes we use that if somebody has a bronchial asthma or like a lot of wheezing and stuff, we use that. So there are stress tests where we can do even for people who cannot walk.
Honestly, this is fascinating to me because every question I'm asking, you're giving me an answer. Oh, this is also possible. Is there a thing like this? Everything is like aha moment for me. I don't know about others. My face is on the camera, so I'm trying to hide my emotions, doing my best. But this is fascinating. Very, very sophisticated, advanced. I'm really fascinated. Thank you. What is the relationship between dental flossing and heart disease? There are some videos out there that says dental flossing can cause heart disease. Is it really true?
No, dental flossing does not cause the heart disease. So there is an inflammation. So somebody who does not have a good dental kind of issue, like if somebody has a gum issues where there's a lot of inflammation. So by doing the flossing, actually you can decrease the inflammation, so that in fact you can decrease the risk of the plaque inflammation and stuff. So actually I see dentists, a lot of them recommending, oh, you need to do a lot more dental cleaning, because there is some studies correlating that people who have a lot of gingival or dental kind of inflammatory disease have a little bit more risk of the plaque rupture and the heart attacks. But indirectly, yes, not directly, but it helps if you floss. If you have a dental inflammation less, overall body inflammation goes down. So there is a small possibility of the inflammation of the plaque, which could rupture, which could increase your rupture. So indirectly, inflammation causes the plaque rupture. So that's how we can explain that the inflammation there. So that there is a test called a CRP, or a C-reactive protein. So that's one of the tests we do regularly. So that indicates how much inflammation you have in your body. So just in generalized test, there is some cardio CRP too. But if there is higher inflammation, there is some data that the risk of the plaque rupture will go higher.
I have asked you so many questions, bombarded. I think I'll take a quick pause to tell you something from Dr. Ranga Reddy Garu. Just a comment from Dr. Ranga Reddy Garu, chairman of Tana Physicians during the 90s. Arranged many programs during the time to bring awareness of heart disease among Indians. I'm very happy that Tana leadership has arranged this program. My friends Murthy Garu and Srini Garu have done an excellent job of bringing awareness of heart disease. Congratulations.
Thank you. I just got elected unanimously as a vice president of API. So my goal as a president of API in 3 years is to have a more awareness for not only Telugu people, but whole South Asians, Indians, to take care of themselves, being more proactive rather than reactive. I think that's one thing. We need to be more proactive. And then we need to understand that heart disease is more common. We have a lot of CEOs, we have a lot of smart people, but they don't take care of themselves. I think you need to spend time on yourself. I'd say after 50, you need to give 1 hour for your body. That's what I do. Every day I want to give 1 hour for my body and mind together. So I want to do 10,000 steps. I think I want to don't want to see a cardiologist. So I want to do it the best I can. But 1 hour after 50 is must for every Indian, for everybody, but especially for Indians. You need to give 1 hour for our body.
Arti, congratulations.
From my perspective, Pranati Garu, I think Dr. Rangareddy Garu has contributed so much through organized medicine, is one of the best presidents of AAPI, number one. The second thing is, I really, this is so heartwarming. Myself and Dr. Ramaka Garu, Srinivas Ramaka Garu, is also in the audience. So we did one seminar, I think, a year and a half ago. And it was also, we had a great satisfaction. And thank you for inviting me and Srini Garu. One passionate appeal. Tana is a leading organization of not only the medical community and other forefronts. Please increase the awareness of CPR training in every city by doing the mass CPR campaign. Call it as a mass CPR campaign of Tana. And I'm very pleased to say, I know it is in the making, Dr. Uma Katiki Garu approached me a few months ago to have the Tana affiliated or Tana endorsed community CPR training in Chicago, which hopefully will be doing in the next month or so. So thanks again for the wonderful support. I tell you, when we are talking about these CPR campaigns and also the things, the one, recently, like a couple of years ago, I founded the first Indo-US CPR training center at the National India Hub. We trained, our teams in India and here incessantly for the past 15, 20 years, we have been training. The last one that we did in Hyderabad, the Gandhi Medical College Alumni Center. 5,500 people were trained in 2 days, thanks to our partners with India. So this is just some humble appeal. Do your best to raise the awareness. And even if you can save one person every day from the sudden cardiac arrest, your mission is accomplished of saving lives. Thank you.
Yeah, there was a question about the Aura Ring. So I think Aura Ring definitely changed my perspective. Knowledge is power. I think apart from my 10,000 steps, it gives me a lot of data about the sleep. I think that's what I was kind of not doing a great job with my sleep. Now it tells me I have a sleep debt of like 2 hours. So I tell my wife, so my ring is saying I got to go take a nap. So I think from a sleep point of view, it's helping me, but like knowledge is power. So I try to track everything, whatever we can. But I think you need to have some kind of a measurement, either checking your weight every day or some kind of a steps on the phone. So that will give you the information so that you can change in a positive way. So if I gain 2 pounds, I know that what I can do that day. So if I check my weight every day. So when I know that in the morning that my weight is half a pound up over the weekend, so that I know that by end of the day, I want to get that half a pound back to where I want that to be. So I think that is the way. I think we have so many avenues out there. We need to use the technology to make our life better, our quality of life better, quantity better. To me, quality of life is more important than the quality is more important than the quantity.
Thank you. Pranati garu, I know everybody's time is precious, especially over the weekends, We can keep on going like Energizer bunnies, myself and Srini garu. At least I can speak for myself. I still have 2 to 3 hours. But in all fairness to everybody, there are a couple of questions, which I think I should answer. Number one, Homa. Again, this is not something about the religious practices. I myself practice, some other religious rituals. That's not an issue here. This is purely a scientific fact. Homa produces so many emissions involving unwanted gases like carbon monoxide. And it is just like one of my colleagues, pulmonologist, said, if you're sitting at the Homa for a long time, it is like smoking hundreds of cigarettes. So I'm not against it. The Homa is our, we grew up with all the rituals. As long as we believe we should continue, but just make sure there is adequate ventilation. Ventilation is very important when you're doing any kind of Homa. That's why the lot of Homas that I attended in India and here, they got open thing, So that definitely will reduce the impact of, smelling breathing the carbon monoxide and other things. The second one, which is also a very important thing, is the cough. I think the person who requested, I forgot the name, my apologies. Cough CPR. Trust me, cough CPR is a myth, okay? And it is an unscientific information. American Heart Association does not promote cough CPR, but there is only one exception when Dr. Srini Gangasani is doing a catheterization procedure, watching at the monitor carefully, and he will ask the person to cough. That is the only area where the cough is important from the perspective of, the cardiac, helping the heart and the lungs, mostly heart. So please, and this is not the first time. Hundreds of times I was asked the same question, cough CPR. In American Heart Association books, cough CPR is not advocated. Thank you.
So I agree. I think sometimes when we do the catheterizations, if the catheter in the heart, it goes into a little fast kind of rhythm. So we tell them to take just a cough so that sometimes that can make the heart can go back into normal rhythm. But apart from that, it's not that useful in a regular setting. So I look at a couple of questions I'm looking at here. So they were asking about the echo test. Echo shows only if the heart muscle or there is a valve issues. It's not going to tell about any blockages usually. And there was a question about the high altitude going to the Kailash and stuff. So high altitude, definitely your oxygenation is going to be lower. So you will put your heart under a little bit more stress when you go to the higher altitude because oxygenation goes down significantly. So please do have your heart checked before you get those kind of high altitude kind of a thing, because you will be putting your heart at risk. And that if you have a heart disease, or if your heart muscle is weak, if you have a cardiomyopathy, definitely you need to make sure that your heart is at the best shape possible before you take those kind of things.
Before I pose any more questions, Andy, first of all, I've been bombarding you with a lot of questions. Inka questions vastunayi, and majority 99.99% మీరు ఆన్సర్ చేస్తారు. నేను ఇంకా క్వశ్చన్ చదివే లోపు మీ ఆన్సర్ కనిపిస్తుంది అక్కడ. సో ఇట్ షోస్ లైక్ యు ఆర్ లైక్ రీడింగ్ మై మైండ్ టు. నేను ఏ క్వశ్చన్ అడుగుదాం అనుకుంటున్నానో మీకు ఇక్కడ ఆన్సర్ వస్తుంది. ఈ క్వశ్చన్ చూసేసరికి మీరు ముందు ఆన్సర్ చేసేసారు. సో ఇట్స్ రియల్లీ రియల్లీ గ్రేట్ అండ్ వెరీ ఇన్ఫర్మేటివ్ సెషన్. Having 2 hours spent to the community is not a small thing, especially with the knowledge and expertise. Like I said, all the AIs, the questions adiginappudu, yes, they will answer. They'll give you 10 different answers, but we don't know which one to go with. The clarity that you gave us, the depth of the information, all these, I think a person like me, idu inkoka 30 సార్లు వింటే maybe oka 3 విషయాలు కరెక్ట్ గా అర్థం అవుతాయి, to be honest with you. I'll be very open with you. And what I understood was, ఈ కుర్చీలోనే కూర్చుని 100 స్టెప్లు అయ్యాక I have done an excellent job అన్న రియాక్షన్ నా ఫేస్ ఉంటుంది. I have done a fantastic job today. 50 నుంచి 100కి వెళ్ళడం అనేది నాకు ఒక మైల్ స్టోన్ లా ఫీల్ అవుతా. ఈ రోజు మరి 100 పక్కన ఇంకొక 2 సున్నాలు యాడ్ చేశారు, which is a big thing for me. Don't ask me what age I am, but seriously, I understood that exercise is an integral part of your life. If you really want to be healthy and don't want to go to doctors, this is the actual prevention that you should take. Not the cosmetics that you shop around, not the deals that you have to talk about, but it is about your internal health, and the real beauty lies there. It was very, very nicely communicated. Like I said, all the medical jargon మీరు కామన్ మ్యాన్ కి అర్థమయ్యేలాగా చాలా బాగా ఎక్స్ప్లెయిన్ చేశారండి ఇద్దరు. Thank you. And thank you, Tana team, Uma Garu, for giving me this wonderful opportunity to moderate. I have learned a lot personally, and I think from everybody, the same comment is coming over and over that please schedule these sessions. They are very informative. One about women menopause, and even, anything like this, getting it from experts is super valuable to all of us. This is truly meaningful and truly priceless. Over to you, Uma Garu. Thank you again, Srini Garu and Murthy Garu. I hope I'll get to meet you in person. Not as a patient, but just to take the good best practices.
Thank you. I think Pranati, you did a great job.
Thank you very much.
I think I know there are a lot of questions. Thank you, Tana, for giving me the opportunity. Uma Garu, thank you. I know you are on the things like how the whole planning point of view. Thank you for postponing it when I had a family emergency. Thank you. I think this is the best you could do for the community point of view. I think prevention is better than cure any day. I think we need to take care of ourselves. From a selfish point of view, my point of view, when I want to tell patients to lose weight, I think if you're not in shape, they may say, doctor, did you look in the mirror? Because sir, adam chustunnara ante anam baagundadu. Andukosamu I want to keep myself healthy and fit, so that when I tell somebody, I want to make sure that I am following what I'm preaching.
Thanks again, Uma Garu. Thanks again, Pranati Garu. And thank you all the leadership.
Thank you, Andy.
And also equally important to all the members. Thank you.